Okay, folks, we're going to look at how to take blood pressure using our sphygmomanometer. This is the manual way, not the kind of cuff that you do in Shoppers Drug Mart, press the button. So we're doing this for our lab. So first of all, we have to locate brachial artery. If you find your subject's bicep on the medial side, which is on the inside, the brachial artery should be right about there, at least the part of the brachial artery that we're going to listen to for movement of blood. Okay. So the cuff that you're going to use in class may have the stethoscope integrated in the actual cuff. This one is separate. When you put this on, make sure the cords go down, goes over the subject's arm, and you make sure this part is not all twisted up. So you can kind of tighten that up, make sure it's going to cover just a little bit of that stuff that I put on there. Okay, the stethoscope has to go on where the dot is. Pro tip, don't put these in your ears yet. Because Velcro being adjusted and all the shuffling will be really loud in your ears. You can learn that the easy way or the hard way. Okay, so this goes on the brachial artery. Oops, try it again. And in the video description, I will put a link to an interactive website that we used in class to help you learn why this works. Okay, so our gauge. This is measured in millimeters of mercury. And make sure the dial here is turned clockwise. That will have the valve turned off. Otherwise, when you pump it up, the air just leaks out as fast as you put it in. Now is when you put the stethoscope in your ears. Now, your ear canals don't go straight in. They kind of go in like this. So if you take this and you just twist them, so they go down like that a little bit, they'll go in your ears a little better. Make sure your ears are clean for everyone else's hygiene afterwards. You don't want to be that person with wax on the stethoscope. This goes in your ears, and you have to make sure that they're kind of fit in there snug. If you have trouble hearing things outside, then it's probably fitting in correctly. Now, when you're doing this, try not to be too cumbersome. Hold the gauge in one hand and the bulb in the other hand. Your thumb and your forefinger are going to be what's going to control this dial right here. Okay? So all I'm going to do is going to pump that up, and for most people we can go up to about 140. I'm a little closer here, Ryan. Yeah. We can go up to about 140, and at that point we are going to be closing the brachial artery. Very slowly I'm going to let a little bit of air out while I listen. When I'm probably first going to see the needle oscillate, and then I will hear a pump, pump, pump in the stethoscope. Okay, actually I hear it now, so I'm going to go back up, let some pressure out. I'm going to take note of when the sound appears. Right now. Okay, so blood pressure, the systolic, when I first hear the sound, is at about 135. I continue letting the air out slowly, slowly, and I listen to when the sound disappears. Right about there. So 135 over 70. Take the stethoscope out of your ears first, and then you can do the Velcro, avoid yourself the pain. All right, so your top number when the sound first appears is your systolic. That was 135 for my subject here. When the sound disappears, that is your diastolic, which I think I said was about 70. Okay, 135 over 70. That's how you take blood pressure.